Now, there is no doubt that the novel coronavirus has turned the world of work upside down. This is evident in the fact that workers and businesses in every corner of the globe have been affected, leading to loss of hundreds of millions of jobs. Despite this challenge, some workers are still contributing their quota in ensuring that the world moves on until a solution is found for COVID-19. In celebrating the 2020 United Nations Public Service Day, essential workers and others on the front line are being celebrated. Adebola Brooksland Sunday reports.
In December 2002, the United Nations General Assembly adopted and designated 23rd June every year as Public Service Day, owing to their remarkable act of service to humankind in the midst of the outbreak of COVID-19. This set of workers are being celebrated.
It's time for a coordinated global, regional, and national effort to create decent work for all as the foundation of a green, inclusive, and resilient recovery.
Ilegogo Anthony is the Deputy Director, Chemical Pathology, National Hospital, Abuja. He is one of the many essential workers on the front line to save humanity from the clutches of the unseen enemy, coronavirus.
Some of our colleagues have been infected. So are we going to say because somebody has been infected, I'm going to run away? We encourage them. We support them. But those of us that still on the battlefront, we have to do what it takes.
And thank government for considering to pay the allowances, special allowances for the frontline medical officers and other team that are taking care of the COVID-19 patients.
With me via Zoom to talk more on the contribution of frontline workers in this era of COVID-19 is Dr. Hakeem Lawal of the National Hospital, Abuja. Hello, Dr. Hakeem. It's good to have you on Nationwide today.
Dr. Zainab and all.
Okay, now, Dr. Hakeem, we know we have a lot of frontline workers ranging from media practitioners, the security agencies and all that. But what are those risks that frontline health workers, face in the line of their duty, especially in this era of coronavirus pandemic?
Well, thank you very much. It has always been the fact that you can contract the virus. You understand why you're trying to offer care. We have health practitioners that go into the community, public health practitioners. You have those that are in the hospitals that attend to patients and all that. And so the fear of contracting virus is a very serious problem. There's also the problem of stigma. In some climes, health workers have been known to be attacked because people erroneously believe that they are the purveyors of the virus. So where you live, you go back home and somebody thinks that you're the one that is bringing the virus from the hospital, and bringing it to their community and they start attacking you. That's what happened. That happened, I think it was in the UK somewhere. There's also violence, when you tell a patient that you're suspecting COVID-19 and they may just slap you. And we've had documented cases of health workers being assaulted at their workplace, nurses, doctors, and all that. Then, of course, I wouldn't say this, but at times we are also at the receiving end of some security operatives. We, health workers do night shifts, calls, and all that. You may just be returning from work, and before at times you even show your identity, but they still harass you, and you feel like it's, things can be better done. So these are part of the risks we face. It's not just even the COVID. Last everywhere, we are the ones at the front line that we have to interface. We're also human beings. We're not robots.
Dr. Hakeem.
So we can,
now, Dr. Hakeem, aside health workers, what other category of the workforce do you think could also be at risk?
Yes. In fact, you speaking to me, journalists are at risk. You go to the field, you try to gather information and all that. You meet with people. All those working in shopping malls, crowded places, churches, mosques, where people gather generally. Even security operatives are at risk. Soldiers, those that, because of the kind of work they do, they interface with people. They don't know where what, because it's not written on anybody's face whether you have COVID or not. And sadly, we're in the community transmission phase now. You know that majority, like 80% of people with COVID may not even show symptoms, and they can transmit this virus. So like I said, the media workers, journalists, security operatives, everybody, you go to the market, people working in the market, you meet people.
Okay, now, Dr. Hakim, how best do you think frontliners, can be supported and motivated by government?
Okay, well, I can break into three. Of course, first is the fact that we want government to provide the tools, the equipment, the personal protective equipment, the PPEs, the masks, the gloves, so that you are incentivized and you're not going with, it's like a soldier going to the war front without bulletproof vests. That could be very detrimental. And so that's the first one. Of course, we are happy government has started responding in terms of incentives, financial incentives. The hazard allowance, so far we're happy that health workers have started receiving their hazard allowance, which was negotiated. So that is, but beyond money, there are many ways to incentivize health workers. For instance, tax reliefs, free. There's some international airlines offering free flights to health workers. They're just trying to appreciate the fact that we are heroes in this era of COVID, where you can actually, you don't know whether when you go into the work front, that you come back home with the virus. And of course, your families are also all exposed. Then, of course, there's also the...
Thank you very much, Dr. Hakim. That will be all for now. We thank you so much, and appreciate you sharing your thoughts with us on Nationwide. Thank you very much, Dr. Hakim.
Okay, thank you very much. You're welcome.